A man starts testosterone therapy. 2 weeks later, he tells me, "Doctor, I don't feel anything. Did this even work?" This is one of the biggest mistakes men make. They expect testosterone to work like coffee or like a pain pill. But testosterone does not work that way. Some things improve fast, some take months, and some improve only if everything else is in place. My name is Dr. Slava Fuzayloff. I'm a board-certified internal medicine physician. I work extensively with men hormone health. Let me explain you what really happens week by week. First, fastest changes. The first thing many men notice is mental clarity. They say, "My head feels clearer. I'm less irritable. I feel more stable." Not excitement, not aggression, just more balance. This can start in 1 to 3 weeks, sometimes even earlier, sometimes closer to week 4. Next is energy, not superhuman energy, not jumping off the walls, more like I'm not dragging myself. I don't crash at 3 p.m. This usually improves in 2 to 6 weeks. If by week 6 you feel absolutely nothing, we start asking questions. Now let's talk about sleep. Some men sleep deeper. They wake up less. Recovery feels better. This usually improves in 2 to 8 weeks. But very important, if someone has sleep apnea, when you snore at night, which means breathing stops during sleep, testosterone alone will not fix that. That must be treated separately and beforehand. Now let's move to slower changes. Sex drive. This is what most men expect to change immediately. Sometimes it does, but more often it improves gradually. Typical timeline is 3 to 8 weeks. And remember, stress, mood, relationship quality, and sleep all affect sex drive. Now, erections. This is where expectations are often unrealistic. Erection depends mostly on healthy blood flow. Testosterone helps desire, but it does not repair damaged blood vessels. Improvement here usually takes 6 to 12 weeks, sometimes longer. And sometimes the improvement is moderate, not dramatic. Now the slowest category, muscle and body composition. Testosterone helps your body build muscle, but only if you train. Strength often starts improving in 8 to 12 weeks. Visible changes, meaning you actually look different, usually takes 3 to 6 months. Now, fat loss. Testosterone is not fat burning medication. It can improve recovery and workout quality, but diet and consistency matters more. Fat changes usually take 3 to 6 months or longer. Now, here's the most important part. Do not judge testosterone therapy in the first 2 weeks. By 4 to 6 weeks, you should usually feel something. Better energy, better clarity, better recovery. Not everything, but something. By 3 months, the pattern should be clear. If by 3 months there is no meaningful improvement, we reassess the diagnosis, we question it. By 6 months, body changes and strength changes should be noticeable if therapy is working and lifestyle supports it. Let me set realistic expectations. Energy, often moderate to strong improvement. Clarity and mood, often noticeable. Sex drive, moderate improvement. Erections, variable. Muscle, gradual. Fat loss, slow. Testosterone therapy works best when expectations are realistic and monitoring is structured. It's not magic. It works according to how the body normally functions. If this helped you understand the real timeline, please like the video and subscribe to the channel. It helps the channel grow, and I will continue explaining hormone therapy in a clear and practical way.